Hey guys, happy Tuesday. How's it going? Combat Craig coming at you live. How'd you like that 15-minute notice thing? Hopefully that worked out. We'll spend a minute or two and let people come on. So this one is called Has a VA Doctor Given You the Wrong Diagnosis? And I guess I'll add no diagnosis to that as well. We'll talk about both. Um, if you are new to the live stream, howdy, welcome. If you have a question, type a capital Q. So I know you're asking me a question. I'm monitoring the chat right now. But if you put Q, it's easier for me to see that you have a question for me. And then if you're watching the replay, do the same thing. I answer the questions in the comments, try to answer all of them. So I'll be doing that after the live stream in the weeks and days to come. My audio was a little blown out yesterday, so hopefully it's better today. So let's get into it. You've gone ahead and got a diagnosis from a VA doctor. Now you think you have the wrong diagnosis, or you have the wrong diagnosis. What's the next step? So you need to have a diagnosis for your disability if you want to win your VA claim. So if you've been watching me for any period of time, you're hopefully that's getting through. So now you've like, all right, cool. I'm not going to win this by just filing a claim. Hopefully a standard claim submitted by a VSO. Hope for the best, spray and pray. I don't want to do that. I want to get strategic. I want to get surgical with this. Perfect. Good first step. So once you figure out you need medical evidence, from a private doctor or a medical doctor. It could be from any medical doctor, and it could be in your service treatment records. You just need current symptoms. So you're going to need a current doctor, whether it's your VA doctor or a private doctor. Either way, you need this medical evidence. So you figure that out. Next step. Now, how do I get them to do this? Well, you don't want to. So you're dealing with the VHA if you're seeing your VA doctor. So that's the Veterans Health Administration. But when you file a claim, you are filing a claim with the VBA, which is the Veterans Benefits Administration. They are not the same. It's not, they're all the VA. They're totally different. So I would start by recognizing that fact. And when you're going in, you have to this is where strategy comes in. If you are seeking a diagnosis for something from a VHA doctor, I wouldn't tip my hat and tell them what you're doing with the claim. It's really none of their business. And, you just need to get the diagnosis that you're looking for. You don't really need to tell them what you're doing. You're about ready to file a claim. You have your intent to file. Maybe you filed your claim and now you're coming in and try to clean it up. Whatever you're doing, you don't need to tell them. It's none of their business what's going on. You need them to type in a diagnosis. And then when the VBA goes in to do their due diligence, it's just sitting there. ICD code, boom, got it. So that's the goal that you're shooting for. And it's all about strategy. You have to know what you're doing and, keep an eye on these doctors. There's a way to talk to these guys. And when you're talking to them, just keep your eye on the prize here. You're going to have some problems with the VA doctors. They suck. And we'll go over some of those kinds of problems. But your goal is to get the diagnosis. So if you can't get it at a VA doctor and you've worn that out, fine, go to a private doctor. Goal is to get a diagnosis. So VA doctors are famous for writing down notes, just like session notes. And they're limited too, right? Because you have to go to your primary care. And then you have to go hit them with all your points. And if you're doing your primary care, you need to talk about every service-connected disability not getting better, FYI. And then if you're going to a foot specialist, like for my plantar fasciitis that's acting up, they'll do a consult to a podiatrist. These things take time. This podiatrist might take a couple months to get to. So just kind of keep that in mind. You might not get another shot at this guy, so it wouldn't be a bad idea to get a private doctor diagnosis going as well. You can use the Mission Act if you want to do it for free, or pay. Again, don't let money get in your way of getting your diagnosis. And don't let yourself get in your way. Diagnosis is the goal. The right diagnosis is the goal, because you currently have zero diagnosis of the wrong one. So VA doctors are famous for just typing notes. And I don't know, I just kind of ramble on about this stuff. There's like notes and there's mentions, and just kind of using my own experience. I finally won my PTSD claim this last time around. And when I was doing research, which I strongly urge you to do research, get your claims file. And I'm like, I think my claim last time I filed my PTSD claim, I was missing the diagnosis. So I started searching through my entire claims file, and it's like, yep, there's stuff in there from 1998 or 2008, I mean. And then there was stuff in there from 2013. I started kind of getting more into the VA. And there's a lot of, if you search for PTSD, it came up about 55 times, but there was no diagnosis and no diagnostic code. And that's about the time when I realized, like, oh, duh, I don't have a diagnosis. So whatever that means for you, you need to do something similar. They will mention it a lot, but they won't diagnose you. They'll dance around it with words, but mentions and oh, my doctor gave me an opinion and he thinks it's combat PTSD. If it's not a diagnosis, it's shit. It's completely worthless. So I'm going through this right now. I see a VA psychologist, talk to him, and a VA psychiatrist to do the pills. And they are trying to give me my sixth mental health disorder and give me bipolar disorder. And in this particular case, I'm resisting it. Like, what are you basing this on? And I'm giving them a hard time. I am definitely being adversarial with my VA psychiatrist because my VA psychologist doesn't necessarily agree. So in this particular case, this lack of diagnosis is actually helping me because I don't have bipolar, and I don't believe a doctor that I've met over the internet and talked to like 3 times, and then she moved on, and then I got another one, and then that one moved. Like, I've had 3 VA psychiatrists, and they will import the notes and just regurgitate what the first one said. I'm like, you guys are complete clowns. I'm going to go with my private doctor that I've been under the solid care of since 2008. I'm going to go with what he says. He doesn't say bipolar. So, keep that in mind when you're dealing with the VA doctors. They're going to play games with you. Your time is limited. Get your intent. Leave yourself enough buffer to get your diagnosis. Submit your intent to file. Figure out what you're trying to land. Are you trying to do a major depressive disorder claim? Is it a combat PTSD, generalized anxiety disorder, somatic symptom disorder, whatever it is? Where are you going to get your diagnosis? Give yourself some leeway because you're going to probably need to get to a specialist like a psychologist. If you don't have a psychologist, you're definitely going to go to your primary care and they're going to have to send you a referral. So, go down that road, but also make sure you hedge your bet and get a private doctor. Go to whatever that, I can't remember it, Patriot Care, whatever that stuff's called. Get it one way or another. Don't let yourself get in the way of your diagnosis. Don't let money get in the way. That's the stupidest, easiest thing to avoid. Just pay. And if you have 2 or 3 diagnoses, fine. That's a lot better than 0. So, if you don't get a diagnosis, you're dead in the water. You need to have a diagnostic code, so AKA a ICD code, and that's what you're going to file your claim against. I don't have generalized anxiety disorder, the code. I mean, I have the rating and the symptoms and whatever, the diagnosis, but can't remember. Anyway. You need a current diagnosis. So current diagnosis, current symptoms, and a nexus linking your current diagnosis and symptoms to your active duty service. And this is most likely going to be on a direct service connection or a secondary service connection basis. No ICD code, no diagnosis, out of luck. Now you're filing your claim without this. And now you're turning your claim into a fully developed claim, into a standard claim, and you're hoping the people at the VA are going to, like the VA rater is going to be able to sift through these notes and kind of come up with a diagnosis versus just, here you go, here's your diagnosis. That's why it's so important to hand them one. You might also, another thing you might run into is, in addition to lowballing you, underdiagnosing you, they do that on purpose too, by the way. If you might end up with a competing diagnosis. You might be going in for generalized anxiety disorder. That's kind of your goal. You know you have anxiety. And then they're trying to say, oh, there's nothing wrong with you. Take some Tylenol and walk it off and quit being a pussy. That happens too. So you might end up with, I talk a lot about psychiatric conditions because I'm most interested in those. And it's just funny dealing with the VA and all their head shrinkers. But you're going to need to, if you have competing diagnosis, I would that's fine. Stay the course. Go to a private doctor. Make sure you land that on a piece of paper, on a DBQ and a Nexus, and get all those things together. And if your VA doctor's kind of gone rogue on you a little bit, that's okay. You can let them sort it out. If they don't do right by you, you can appeal it. But you need to walk up with the diagnosis of the thing or disability you're trying to get service connected. Without that, you are going to be SOL. So we have 52 people on today. 14 thumbs up. Let's see what's going on in the comments here. What's up, Jeff? Oops, I think it's a little off. Tom Dix, what's up? Yeah, I usually do this at night. And yesterday was like the first time I've done it during the day in a long time. And I'm just going to keep popping on. There's no time limit. I know I say stuff that's relevant. And we ask questions and stuff, but I can just keep doing these live chat things. The goal is to answer questions in front of as many people as possible, so it helps as many people as possible. One-on-one isn't as interesting as 100 people benefiting from it. So that's what I'm trying to do. What's up, Linda? Alex, Javier, AJ. You're cutting grass? You're not cutting grass if you live in Idaho. It's freezing up here. Sounds quiet. I could turn it up a little bit. I want to blast it. You are my worst nightmare? Okay. I guess type a question mark. That's kind of like a cue. What happens at a higher level review for a TDIU that was denied, and what should I be doing to prepare? Medical evidence. If your TDIU is denied, there is a problem with your current rating. I don't know if you're going for scheduler or extra scheduler TDIU. There's a problem with you have the rating, I'm assuming. There's probably a problem with your vocational background. You might have the medical evidence and stuff. I don't know if you got a vocational expert to weigh in, or if you were able to articulate your points about your vocational problems. I'm thinking that's probably where your problem is. So you could prepare by going and getting a vocational expert to weigh in. A vocational expert is kind of like when you're doing a TDIU claim, it's different. It's not just medical, it's medical and vocational, right? So the doctor says you can't lift. And that gives a pretty good amount of information. Like, you and I can sit here and go, well, if you can't lift your ass out of bed, you can't lift your ass into a car, you can't drive. There's all these other things that you can't do if you can't lift anything or very little. But a vocational expert will be like, hey, in the big labor book of workers or whatever, any job that requires, you have to be able to lift 5 pounds. So a vocational expert actually has the same weight as a doctor in a TDIU claim. And more people need to know about vocational experts and get one. That's how you do it. And most of these guys, you can find them on the internet. Vocational expert TDIU claim, Google it. Google is your friend. And check it out. What's up, Sean? You just found me on the page? Cool. I turned the volume up a little. All right, now I turn it up a bunch, so people are going to get pissed off halfway through this video. Hopefully it's better now. Okay, let's see. I don't know if that's a question. Oh, you're in the CNP exam. Good talking to you yesterday, Ryan. Pissed off the mess. I'm not gonna do this. VA claims master. Happy Taco Tuesday. Yeah, I wonder what's going on with Taco Tuesday day to day. What's up from Savannah? Metal Mark, I don't think I've seen you for a little bit. Welcome back. How's it going, man? Happy Thanksgiving. I like them personally. It's personal preference. There's not an alternative to them, so that's something to keep in mind. I like them because I don't like to drive to the doctor. I don't like to sit in close proximity to any human being, much less a doctor that's probably going to want me to just jump out of my chair and choke his ass. So I actually do better on video conferencing kind of stuff. I get it, but at the end of the day, you got to remember they are looking at your eyes, blink, and your facial reactions, and they could tell pretty much 95% of what they need to know by looking at you through a computer versus looking at you in person. Your mannerisms, if you're depressed, you're going to be a certain way and you're going to say certain things, and they can hear all that and see your reactions. So it's effective, and yeah, I like them better. They're not for everybody. I totally get it. But, you know, that's where we're at, especially right now where VAs are shutting back down again. So get used to it. What's up, Derek? Let's see. Yep. Ryan's going into a CNP exam. Chris, happy Thanksgiving. Appreciate your info. Does a IMD, independent medical doctor, that's a different way to verbiage it. Does an independent medical doctor than the VES CNP doctor decisions way better? I have an IMO, independent medical opinion, that I'll be presenting during your HLR. It's hard to tell if it's going to weigh better. Typically, the VA rater is going to rely 100% on the results of your CNP exam. That's just the way they do it. Their policy under the M21-1 adjudication manual is like, yeah, if they have medical evidence, if it's like this, if it's folded or crinkled or not signed, discount it. So it is very common for them to completely discount your independent medical opinion from your private doctor. That's fine. You know, it sucks, but it's fine. What you're doing is legal. Go in there and tell your story to the CNP examiner and nail it with him. If you lose this at the HLR, and I don't know if you got an independent medical doctor for an HLR, that doesn't make sense because you can't introduce new and relevant evidence. Maybe you're doing a supplemental, or I'm not sure. I don't have all your info. Either way, if you lose this at the HLR and you're bouncing back and forth between supplemental, whenever you're ready to get off the hamster wheel, go to the BVA, and the BVA will accept your independent medical opinion because it's a legal document from a private doctor. And whether the VA rater decided to accept it and use it for rating purposes or not is irrelevant because the raters follow the guidelines. The BVA follows the law. So what you're doing is legal. When you get up into a higher legal argument, you want your ducks in a row legally, if that makes sense. Navy diver Gary, kind of live one. Awesome. Wrong diagnosis, no diagnosis several times. Very common. It does happen with private providers. But with private providers, you could go to one. Well, that sucked. Go to another one. It's easier to go to private providers. At the VA, it's harder to fire your people. You can, but it's like, okay, so you went to your primary care. They referred you to some jackass hotshot psychiatrist that didn't agree with anything. I want to fire that guy and get a new one. That could take a couple months. It's harder. A private doctor, you go to one, whatever, you pay your money. That didn't work. Go to another one the next day. You know what I mean? You can get into them quicker. Don't let any of these little details. I know they're expensive, they're time consuming, they're a pain in the ass. These are just little obstacles. Your goal is diagnosis. These are little bullshit things that cannot get in your way of your diagnosis. So just kind of keep that in mind. Diagnosis is the goal. I don't care if I have to run through 25 doctors. Get it? Get it. How can you get your doctor to give you a Nexus? Ask them. VA doctors, you can ask them. They suck. They'll say stuff like, yeah, because now if you're asking for a Nexus, now your VHA doctor knows exactly what you're doing. You're in the middle of a claims process or you're about to file a claim. And then they'll do something like, oh, well, this could be a conflict of interest, but really what they're saying is they're lazy and they don't want to help you. So it doesn't hurt to ask. Go to a private doctor. Before you pay him, ask him if he writes Nexus letters. If not, keep making phone calls. Be creative. Again, don't let the Nexus, the diagnosis, the stuff cannot get in your way of your VA claim. If you fall short, you're just dead. You wasted all your time. So you either get into this and commit to it 100% and do it, or don't do it at all. David, denied PTSD in August. Then I called a few weeks ago, back my claims. They're reviewing it. You got 50%. It sounds like you already got it. If you got 50%, you already got it. I'm not sure I understand your question. You put in a claim for major depressive disorder. You were diagnosed for it after your first deployment, and they denied you. I was on meds for it too. So if I don't know how long it was, let's say you got a diagnosis for MDD while you were in, then you got out. I don't know if it's been over a year. If it has, you need current diagnosis and current symptoms. Your diagnosis from active duty service will help you with service connection, but it does not help you with a current diagnosis. A year old, a year and a half, 2 years, that's not current. That's a year and a half ago. Meds are irrelevant. You need a doctor to diagnose you, and you're going to need the Nexus. It's going to be my guess. St. Lou. What's up, Terrence? Edward? Yeah, I think your TDIU will be denied again at HLR, unless you, I don't know anything about your claim. I don't know. I haven't filed TDIU claims. I did a little research on this. This is my opinion. The vocational expert is huge. Definitely talk to one and make that determination on your own. If nothing else, at least a vocational expert can help you like, oh, well, you don't even have this, so you don't even need to hire me because you're weak over here. They can do that too. They know their stuff. Gary's got a diagnosis from a VA doctor for migraines, pulled a blue button report, and he put a lot of stuff in there that we didn't talk about, but will go in your favor once you file your claim. Good, and that's the determination that you need to make. When you're dealing with a VA claim for migraines, it really comes down to the diagnosis. You're still going to need a Nexus, and then you're going to need the severity of your symptoms. That's where you're going to either end up with a 0, 10, 30, or 50. So being able to go look through there and like, whoa, what is this book doing in here? Okay, that's interesting. Now, is this going to help me at all, or is it going to hurt you? So it sounds like you feel good about all the nonsense that was written in there. I get it. It sucks to have all this irrelevant information clogging things up, but your fight is with the VBA proving your claim, not the VHA. It might be with both, but right now you want to go in and win your claim. Nice doggy. Get used to it, David. That's what they do. For a living, the VA denies veterans. Then, sounds like you're a little frustrated. This is the next step. They want you to be frustrated. Then the next thing they want you to do is quit, and then they want you to die. Get used to it, get over it, go win it, is my suggestion there. I mean, that's all you could do. What about claims for Camp Lejeune, the bad water? Yeah, it's a presumptive condition. I don't have the list in front of me. I know it's probably like a 30-year span, like 57 to 1987. If you were there, and I don't know what there means. I don't know if I think you have to be stationed there for 30 days or something like that. If you're having, diabetes or whatever that bad water causes, and you have a diagnosis of all that kind of stuff, you can hook your diabetes to your active duty service by way of a presumptive service connection claim. Got to prove it. You got to prove it less, but prove it nonetheless. So you're going to have one of those nasty things. And obviously, when you have diabetes and some of these bigger problems, you're going to have the diagnosis, but still, check. Wouldn't be surprised if you don't have it. I don't know if I could tackle this one. VA clinical worker since 3 months diagnosed with chronic. Right. That ain't going to work. First time catching live here. Yep, Meniere's disease is a inner ear condition. I don't have the other one off the top of my head. Vertigo is another one that's in there. Meniere's, vertigo. They're tied really close in with hearing loss and tinnitus claims. I would say that secondary to migraines. Yep, PTSD or tinnitus. Yep. Go in and do your research. 38 CFR Part 4, the schedule of rating disabilities. Go in there and look at the rating criteria. See where you fit in there, and watch out for pyramiding, and then watch out for what you need to prove it to get to the rating and ultimately the compensation you deserve. Yep. A lot of people kind of come in, and if you drop in here and you're disengaged with the VA enough, and you know something, please hop on in here and help somebody out. So you were prepared for your CNP exam, and this is the CNP exam prep. It's what should I expect? What I'm going for a CNP exam for migraines. What do those look like? Have you guys had one? Yeah, I've had one. Usually it's a phone call, especially now. What kind of questions do they ask? What kind of evidence do they look at? So having some prep, so you did that part. They asked you if you had your 21, 41, 38 personal statement, and you did. Boom. So they didn't have it, but you had it when you came to the CNP exam. And more importantly, you had your story, you had all their questions ready to be answered, and you told them. Perfect. Verbiage is everything. Make sure you word it right. Yeah, it ain't hot. It ain't hot in Idaho. Yeah, that's another good place to look. Your problem list and your My Healthy Vet is another place to look. If you're looking there, make sure that you have your problem list and diagnostic codes, these ICD-10 codes next to it. They're like numbers. I think they're 4 or 5 numbers. Without numbers, you don't have a code. Without a code, you have a shitty diagnosis, aka non-existent, probably. Don't know what that is, but if you lost vision in your left eye, I'd file a claim for it. This is a kind of what you want to do for your therapy or meds for PTSD. I do both. The meds is one route. None of that stuff works. Be honest with you, I get the meds and I toss them. Yep, send me meds. They don't work. Just like I've been doing this for so long. Like, in my argument with them is they don't give me real meds. They give me meds that just are garbage. So they're going to make a half-assed attempt to medicate me. That's about how much effort I'm going to put into getting them into me, especially when I've tried it. But therapy might be better for you. Either way works. I would say the lowest impact is the meds, because you see the VA psychiatrist once every 3 months. and that's it. The VA psychologist is probably going to want to get in and fix you a little bit more, but you got to back him off too. Hey, I don't need you every week or every month. I'll see you every 3 months. How's that sound? Is anybody rated for 100% plus 60 service connection to get the extra $3,000 a month? You might be talking about special monthly compensation S. That's the closest thing off the top of my head that's triggering right now. It's 160, and it's not $3,000 a month. It's about $300 a month. So if you're at 100% and you're getting paid the $31.46, which is going to be effective December 1st, I believe, I think you get an extra $350 or something like that with SMCS, Special Monthly Compensation S, housebound. Yep. Hit the thumbs up. Where's my spam stuff? If you want to support the channel, there's a little join button on the channel. They're underneath the videos as well. Appreciate that. Hit the thumbs up. How many thumbs up do we have going on? 56 people, 36 thumbs up. Not bad at all. Yep. And, you know, this is a personal preference kind of thing. Again, I kind of have a different way of looking at the meds thing. But that is the reality of this situation. You're going to take their little weak meds for 20 years. I mean, eventually you're going to get tired of it, but do whatever you got to do. Okay. What's up, Fernando? Yeah, mental health diagnosis must be made by a PhD or a psychiatrist. They can be made by a nurse practitioner or a PA, maybe just a PA, if they're under the care, like the doctor's watching them. If that's the case, it's like, hey, get out of the way. Let's have the doctor sign this. So I would always be shooting for a doctor. Right on, Travis. Have a good one, man. What up, John? Right on, Alex. Yeah, it depends. You got to go look it up and see what. I wasn't in the guard. I don't know anything about it. You got to. It's different markers. I just know about active duty stuff. Yep, still waiting. You're playing the waiting game. Hopefully, you filed a good claim and you didn't build it on quicksand foundation. Okay, I believe the VA in active conditions will use the snow med. I don't know what that means. Thank you. And you're still waiting for a decision on your increase? Fingers crossed, stay positive. What else are you going to do? It's their move. Your move, VA. There's nothing you could do. Being pissed off, stay out of e-benefits. You'll get a letter. I know you want the decision. Just stay positive with it, and no need to go negative until you actually get a denial letter. But you haven't got it yet, so it could go either way. But good luck. Fingers crossed. Yep, Dale's right on the hump, trying to get to that 95.5 or 95, so we could get into the Hundo Club. Hard to tell. Depends on what your rating is. If you're at 100%, I wouldn't even mess around with going to Voc Rehab. You're at 100%. It's like, what are you doing here? You can't work. You're at 100%. But I don't know. I don't think it will. Voc Rehab's a whole nother nightmare thing. Good luck with all that. Been there, done that, got denied. Let's see. Okay, I don't know what link you have, but you got your congressman involved in probably your claim. Cool. Get your congressman involved. If you're not getting, we pay for the VA, we pay for the VA doctors. They work for veterans, believe it or not. If we can't hold them accountable, get Congress involved, get your patient advocate, get somebody with some teeth and chomp on their ass. I know they don't like official complaints, so put complaints on them. Yeah, this is personal preference. I am definitely not a doctor here saying throw away your meds. I didn't get this idea on my own. I got it from somebody that knows what they're doing. And, whatever. Yep, thanks. Thanks for all your meds. Too bad you guys are morons. They're wrong. They're late. Like it's a whole nother thing. Dealing with the VA pharmacist. Yeah, they send the wrong stuff. They send it late. They put about zero effort into that too. So, it's all relative. That's about how much I put into taking the meds. I was diagnosed with adjustment disorder as well. Probably depressed mood. That's basically what adjustment disorder means. You filed for depression and you were denied. Yeah, now you're hopping. Depression and adjustment disorder are different. So you're not a doctor and you can't diagnose yourself. And you cannot say that depression is the same thing as adjustment disorder. Maybe some doctors would make that argument, but I think a real doctor would probably just give you one or the other. You got some work to do there, Tom. Get a diagnosis, figure out which one you're going to go after, and dig into it. Okay. Happy Thanksgiving. Waiting on a CNP for migraines. Cool. Yep. If you're homeless, tell the VA. If you're living with someone else, you're a roommate, tell the VA. If you're couch surfing, tell the VA. Yeah, they will give you a priority on things if you're homeless. Yep, I do. I'm 100% P&T. I still do treatment. I do a lot more than annual stuff. But I'm kind of, I just have a different way. I still don't even believe that I have it yet, even though I've had it for a year and a half. It's been so long of fighting. I want to overprotect myself. You and me both. Not satisfied with your provider who did your VA exam. Was it a CNP exam or was it a regular exam, like a regular primary care? Either way, tell her that you're not satisfied with the service, and you want to like get her on board or get her fired and get replaced. You got to speak up. Don't be afraid just because they're a doctor. Tell them I'm going to fire your ass and I'm going to put a complaint on your ass. Don't be afraid. Just do it. Yeah, it does fast track your claim. Yep. Mm. How long do requests for increase take? That's the magic question. I think everybody would like to know that, including myself. Uh, you were rated at, so did you file for the increase? Or are you inquiring about how long it's going to take before you do it? Do it if you have the medical evidence. Who knows? It could take 2 hours, 2 days, 20 years, 8 months, like no clue. Every claim's different. Every VA regional office is different. Every CNP examiner, every rater. There's so many factors. File it and be prepared to wait, right? Hurry up and wait. We're all used to that. James got up to 90% listening to me. Cool. Yep, do your homework. I'm not going to do it for you. I'm just saying go look this stuff up. I'm not saying go cheat or get Cliff Notes. I'm saying look this stuff up, see how it pertains to you, and understand it enough so you can actually use it and be dangerous with the information. And by dangerous, I mean you can file a winning claim. It depends. They don't do like trazodone and stuff. I was getting prescribed painkillers, and they did a piss test, but that's kind of like more like a drug piss test because it was Norco. But I wouldn't put it past them. I'm just saying, most likely, depending on whether you're on, schedule, what are they, 1 or 2 drugs? Usually it's more of a urinalysis stuff, but I'm sure they do it. Okay. Yep. All over the board. Increase on your back, 3 months, start to finish. Perfect. Oh, you're not satisfied with your C&P examiner. If that's the case, you should be doing that about 2 hours after you get out of your C&P exam. It's not called not satisfied. It's called inadequate C&P exam. I didn't realize it was a C&P examiner. If it's been more than a day, you lost it. You don't get a complaint a month after the fact. Educate yourself about what an inadequate C&P exam is, and get them the next time around. And again, just because you're not the C&P exam was not like it wasn't a treating doctor. It was there to get information. They're hired by the VA for rating purposes, so they're not going to be friendly. They may or may not have thank you for your service. All that doesn't matter. What matters is what they say to the rater and what the rater does with that info. So it's already too late now, but you might be surprised. All right, guys, 42 minutes. I am out of here, and I'll play a little music on the way out. See you soon.